Feeling down and out, too much Pepto or Bengay, TCA, salicylate toxicity. You gotta alkalize that urine, give them some sodium bicarbonate. Pink puffers, Overdose overdid it on the theophylline, overstimulation of all those catecholamines. Block it with some propanol, get that BB back down, reduce the risk of falls. Hey, party's over. Lady belladonna, scopolamine, we are all dried up. We don't need any more atropine. Mucous membranes, don't look so angry. All red and dry. Get you some of that pheostigmine for that anticholinergic toxicity. Acetaminophen, check out that label. AP, GI symptoms, nausea, sweating, yellow skin and whites of eyes. Bugle missed by 8 hours of ingestion for Tylenol gone wild. Hey, almond breath, look at you with that flush pink skin. Exposed to cyanide keeps that O2 from going in. There's a shout out for all those most at risk, laboratory workers and firemen. No fruit pits for you, amygdalin. We're gonna pump you full of nitrates or some sodium thiosulfate before the day's end. The phrase starts with me and ends with you for blue. Methylene blue, where are you? Too many nitrates and local anesthetic, elevated oxidative stress affecting HGB with changes in formation oxidation resulting in methylglobinemia. Unable to carry that O2, patients now full of hypoxemia. Valproate-induced mitochondrial starvation, amino acid level carotene increases fatty acid metabolism decreasing. Hyperammonemia, check that MMSE for proof and reduction in valproate-induced encephalopathy. Synthetic analog of somatostatin octreotide blocks insulin release from the overworked, underpaid beta cells of the legendary pancreas. Type 2DM overdid it on the sulfonylureas. Patient diaphoretic, cool and clammy. Severe extension of hypoglycemia. Not dextrose, not food. Octreotide to the rescue. Ending that sulfonylurea insulin blood sugar feud. Excessive opioid receptor mu kappa stimulation results in respiratory depression activation. Naloxone prevents opioid receptor bind. Reversal from Narcan reduces respiratory compromise. Start low. Repeat every 2 to 3. Still non-responsive at 10 mgs means opioid was not the cause of patient's double-R decrease. Flumazicil, Ramazicon, don't matter the name. Solve that mystery. Check that history of benzo addictions, epileptic conditions, TCA intoxications. These are all contraindications. Flumazicil reverses benzo-induced respiratory depression. It's pretty short-acting, so get ready for intervention in the misdirection of respiratory expression. Toxic alcohol metabolism resulting in acidotic conditions also damages ocular and renal, both much-needed systems. So just remember that first of all, ethanol's from methanol and ethylene glycol. Ethanol's from methanol and ethylene glycol. Hey, yo, GABA, GABA, where'd you go? Too much of that anti-tubercular isonazide? Hit me up with some of that B6 pyridoxine. Alleviate these seizures. Keep those airways clean. Organophosphate, carbamate toxicity. Patients diaphoretic with excessive salivation and lacrimation, gastrointestinal activation. Need some of that pyridoxamone plus atropine for symptoms of cholinergic distress associated with insecticide excess.